ECG is the graphical recording of the electrical activities of the heart. It is a test that measures the electrical signals that control heart rhythm. This test measures how electrical impulses move through the heart muscles as it contracts and relaxes. The electrocardiogram translates the heart's electrical activity into line tracings on paper. Wherein the spikes and dips in the line tracings are called waves or resistors. It is the first diagnostic test done when cardiovascular disorder is suspected. It helps diagnose disorders of both impulse formation and conduction. Identify the basic components of ECG. The basic components of ECG are the P wave, the PR interval, the QRS complex, the ST segment, and the T wave. In ECG, the P wave is a record of the electrical activity through the upper heart chambers, or the atrium. The QRS complex is a record of the movement of electrical impulses through the lower heart chambers, or the ventricles. The ST segment shows when the ventricle is contracting and no electricity is flowing through it, wherein it usually appears as a straight, level line between the QRS complex and the T wave. The T wave shows when the lower heart chambers are resetting electrically and preparing for the next muscle contraction. Describe the location, duration, and configuration of all the components of normal ECG tracing. The T wave reflects the depolarization of the atria with the duration of 0.04 seconds to 0.11 seconds. The PR interval is the time of impulse transmission from ST node to the AV node, with duration of 0.12 seconds to 0.20 seconds. The QRS complex reflects the depolarization of the ventricles with the duration of 0.05 seconds to 0.10 seconds. ST segment. This represents the latter phase of the action potential, in which it indicates early ventricular polarization, normally not depressed more than 0.5 millimeters in length, and may be elevated slightly in some reads, but no more than 1 millimeter in length. The T wave reflects ventricular polarization, wherein it should not exceed 5 millimeters in amplitude. Check the doctor's order for confirmation. Prepare the needed materials and check the functioning of the ECG machine. Then perform and hygiene. Supplies and equipment. So in this procedure, we'll be needing ECG machine and paper, cotton balls with alcohol, chest suction pump, grouping wire, rubber straps, and a metal conductor. Identify and inform the patient regarding the procedure. Provide privacy. Close curtains around bed and close the door to the room. If possible, ask the patient to lie still and breathe normally. Ask the patient to remove coins and other metallic objects which may cause interference of the ECG tracing. Position the patient for the attachment of leads. Have the patient lie in supine position in the center of the bed with their arms at their sides, raising the head of the bed if necessary to promote comfort. Expose the patient's arms and legs and drape appropriately. And also encourage the patient to relax the arms and legs. Disinfect with alcohol swab and apply conductive gel to the necessary body parts where the electrodes will be placed. Place clamps with metal conductor and connect the limb wires using cover and letter codes as indicated on the metal conductor, and attach the distal third portion of the extremities. Apply the chest leads connected to the valves or electrodes using the color and number codes as indicated through the patient's chest. In this, we'll be avoiding positioning of the electrodes directly on the bone. attachment of the limb within chest piece. V1 will be placed in the fourth intercostal space to the right of the sternum. V2 will be placed in the fourth intercostal space to the left of the sternum. V3 will be placed directly between the leads V2 and V4. While V4 will be placed in the fifth intercostal space just at the medically line. V5 will be leveled with V4 at the left anterior axillary line. And V6 will be leveled with V5 at the mid-axillary line just directly under the midpoint of the armpit. Switch on the machine and encode the patient's tape. Check the speed on the ECG machine. It should be set to the standard reading of 25 millimeters per second. Ensure that the machine is in auto mode as displayed in the monitor to record an automatic tracing from lead 1 to V6. Press the start button to record the rhythm. Proceed with the recording of long lead 2 rhythm strip by ensuring that the machine is on manual mode as shown in the monitor. Press the stop button after obtaining a 6-second strip tracing. Press back to auto mode and turn off the machine. Remove the attached limb and chest electrodes from the patient and clean the conductive gel from the patient's skin as well as from the electrodes. Place the patient in a comfortable position. Document the procedure and the patient's response to the procedure. Forward tracing to the heart diagnostic department for reading by the cardiologist. Other considerations. Provide privacy during the entire procedure. Ensure patient safety and comfort at all times. Perform infection control measure before and after the procedure. Identify and manage electrical interference. Correctly calculate and interpret the ECG tracing, by which it includes the heart rate, the P-wave duration, deflection and configuration, the PR interval duration, the QRS duration and deflection, the T-wave location, deflection and configuration, and the QT interval duration. Label the specific components of ECG properly on the obtained tracing.
So let's proceed guys. Ang gamit